Vanakkam. When we deal with customers or clients, it's going to be challenging because each of them has a personal mindset and different needs and wants. But when it comes to dealing with patients, it is even more challenging because apart from the needs and their individual mindset, they are also scared and anxious. So how do we deal with patients and deliver the treatment that they have come for? There are only two things that need to be kept in mind: compassion and communication. It is easy to say compassion and communication are important, but how does it actually apply when dealing with the patient? As with any difficult situation that we face in our life, the answer is there in the Thirukkural, which was written by the saint poet Thiruvalluvar almost 3000 years ago. Yes, he has dealt with compassion and communication, and we shall see that in this video. As doctors, we see patients day in and day out, and no two patients are the same. They can be of many types. We have self-diagnosis, we have patients with an overbearing family, we have patients who are skeptics sometimes, we have pampered patients. So many types are there. But whatever their type, in their heart of hearts, these patients are scared. They are scared about what their problem is, what is going to be done, how is their future going to change, will they be able to get back to work, earn for their family, and more importantly, they are scared of the hospital, the smell of disinfectant, the stretchers, the wailing attenders of patients, and patients even walking around with tubes hanging from their nose and whatnot. It may be a routine for medical professionals, but it may be a scary experience for the patients, and that makes them uncomfortable. We need to understand these patients and deal with them in a customized manner for each patient. But it is very simple actually, because there is a basic principle that needs to be followed. All these differing emotions can be handled by one emotion on the doctor's side: empathy, understanding their pain and anxiety. That is, an understanding of his or her situation. The patient is an individual with a unique mindset, now with a problem seeking help. We need to understand their situation. And what is the importance of this empathy? The saint poet Thiruvalluvar, 3000 years ago, in his treatise, the Thirukkural, has stated categorically the importance of empathy. This is beautifully portrayed in the Thirukkural, that is a couplet, which says, "Arulillarku avvulagam illai, porulillarku ivvulagam illahi yangu." Read as, "அருளில்லார்க்கு அவ்வுலகம் இல்லை, பொருளில்லார்க்கு இவ்வுலகம் இல்லாகி யாங்கு." What do these words mean? Arulillarku refers to people who do not have kindness or compassion or empathy. Avvulagam illai. That world does not belong to them. Which world is he talking about? When he says that world, the world beyond, the world maybe after our death. Porulillarku, the person who does not have money or treasures. Ivvulagam, this world, this materialistic world. Illahi yangu, like a person who does not have. So the literal translation is, a person who does not have empathy or compassion will not be suitable for the world beyond. Just like how a person without money or treasures will not be comfortable in this materialistic world. This Thirukkural emphasizes the importance of arul or compassion or empathy. But empathy alone is not enough when dealing with a patient. We have to communicate with the patient and the caregivers about the management that is planned for the patient. This communication is also quite tricky at times, because the patient and the caregivers may not be in the same mental makeup. In fact, we have differences in the education of the patient, in the behavior of the patient at that particular time, the differing economic status, the age, and the appearance and body language. So when communicating with these different mindsets of people and different categories of patients, it is important to modify our communication. The message may be the same, but the method in which it is delivered needs to differ depending on the patient we are dealing with. For example, if there has been a thumb amputation and we need to advise the patient for a toe transfer, that is, transferring a toe from the foot to reconstruct the thumb so that he can have a thumb. But the method in which this message is communicated to the patient, as I have said, will differ. So, has Thiruvalluvar said anything about this communication? Yes, he has. There is no topic under the sun that Thiruvalluvar has not spoken about. He puts it quite succinctly. திறனறிந்து சொல்லுக சொல்லை அறனும் பொருளும் அதனினூங்கு இல். It reads as follows. திறனறிந்து சொல்லுக சொல்லை அறனும் பொருளும் அதனினூங்கு இல். Let us understand the meaning of these words. The word திறனறிந்து refers to understanding the capacity. சொல்லுக, talk. சொல்லுக means to talk. சொல்லை. Sollai refers to the words that we talk. Aranum porulum refers to virtue and treasure. Adaninungu il. There is nothing like it. So what it means is that when you are talking anywhere for that matter, what you need to do is understand the capacity of the person who is listening to you and choose your words when you talk to them. This capacity to communicate correctly with different categories of people is a virtue and a treasure that can be equaled by none other. Let me come to the example of planning a second toe transfer for a patient who has had a thumb amputation. Now I'll have to communicate this message and plan to the patient and discuss it with him. If he is highly educated, I'll have to talk about the technical details, the advantages of doing this procedure, the donor site morbidity, and the other details at a higher plane. At the same time, if the same message is to be communicated to a less educated person, though I'll talk about all the points required, it would be in a language comprehensible and understandable to the patient. If the patient is at a younger age, I must stress on the usefulness and the aesthetic parts, and if the patient is a little elderly, about the usefulness of the hand after the procedure and the ability to use the hand for earning. So what I should be doing is communicating the same message to different individuals based on their unique characteristics and making sure that the message reaches them and they are able to understand what I want. We are not only doctors, we are also teachers. We teach not only the students of our own specialty, we teach budding surgeons, we teach budding doctors at the undergraduate level, and we also teach the public and create an awareness about the problems that are there. We sometimes have to speak to a general audience also. When we are talking about a particular topic to different types of audiences, the method in which the message is conveyed is also going to be different. Taking the same example of doing a toe transfer for a patient with a thumb amputation, when I am talking to my residents in my specialty, I am going to talk about the procedure in greater detail. Whereas when I am going to talk the same topic to an undergraduate medical audience, the tone of the talk is going to be different. And when I am going to talk to a general public audience, the points that I will be talking about will again be totally different. So two important characteristics when dealing with the patient are empathy, that is understanding the condition that the patient is in and understanding the pain and problems that he is going through, and secondly the communication skills that we have to develop, that is the ability to change the tone of the speech. அருளில்லார்க்கு அவ்வுலகம் இல்லை, பொருளில்லார்க்கு இவ்வுலகம் இல்லாகி யாங்கு. திறனறிந்து சொல்லுக சொல்லை, அரணும் பொருளும் அதனினூங்கு இல். I hope you liked the video. I enjoyed making it. Do click on the shown link to see another Thirukkural, the first Thirukkural that deals with the divine force that helps all surgeons. And do not forget to subscribe to stay connected with the latest in learning hand surgery. Vanakkam.